Welcome to the Startup Grind.
Thank you for having me. It's such a group of people here interested in this. Excited, pollination is really important. I'm from the area originally. Actually grew up 30 minutes from here, went to high school around this area. My father being British, I ended up leaving after high school over to the UK, lived there for about 8 years or so, did my undergrad in biochemical engineering there, worked for Pfizer there. Then I came back and briefly before going back again to do my doctorate over there in stem cell research and molecular biology. And finally said, I'm done with this British weather. I'm coming home and back to Sacramento. Very different here, but I prefer it. But it was difficult, actually, with a PhD in biochemical engineering and stem cell research to find a job in the Sacramento area. And I was either overqualified for jobs or, there was some issue. The closest thing we had was Genentech nearby. So I was looking at places like Genentech, Amgen, and ended up being most of the opportunities in the Bay. And I remember feeling really frustrated. Went to Stanford and talked to some professors there, and they immediately were like, "You got to join my lab." So I joined as a postdoc in Joe Wu's lab, who has cardiology, radiology lab. He's now the head of the American Heart Association. I was really lucky to work with a lot of great people, and including some of the people that were tied to Geron, which is famous for Dolly the sheep, and that work that inspired a lot of my doctorate work. And so after spending a long time in the Bay, I eventually came back here to the Sacramento area. I founded Elevai, co-founded, I should say, right before the pandemic. I remember shaking hands with my co-founder maybe a month or two before everything shut down. And we said, okay, what are we going to do? I said, we're going to build a lab. We're going to get all this stuff done. And by the time all this is over, we'll be off and running. And so initially had a lab in San Jose. We moved that lab to the Davis area, tried to pull some local talent. And then eventually we moved it a little bit east. So now, we have a facility over in the Folsom area. But effectively, I think from the outside in, the Elevai Labs story is like, wow, we founded it in 2020 and November 2023 we're public, and it's just off with a start, right? But it's much more of a bit of an iceberg in reality, right? Where you're only seeing the tip, and the real backstory that you're not seeing is that for me this is 15, 20 years in the making. Spent a lot of time in university and trying different things. And I got to a point during my postdoc where I felt like understanding stem cell research is kind of like knowing how to build a flying car. Everyone thinks a flying car is cool. Everyone would love to have a flying car, but there's absolutely no market for a flying car, right? So what I'm going to do here, and I started really looking around, how do we apply the latest in stem cell technology to something practical today? And ended up sort of by happenstance getting pulled more towards the field of aesthetics. And so now I work generally with dermatologists and plastic surgeons, and we make products. This is our flagship product that we call Infinity. It's a serum that contains exosomes and a lot of other really great ingredients that are clinically proven. And effectively, exosomes are the next generation of stem cell research. Whether you realize it or not, I mean, most people, when they stop and think about it, realize you can't really put a living cell in a bottle on the shelf and make a product from it. And that was a big hindrance for a long time. And so the promise of exosomes is really the ability to take the best that stem cells are producing, and you can isolate that and you can put that into a product. And so initially, a lot of these things have been used in orthopedics and different things. The FDA has come in and said, listen, you can't go injecting this stuff. It has to go through the drug pathway if you're going to inject. But topically, this is still something that is open as a cosmetic area. And we've seen this in the past. So there's other products on the market that are cell-derived, and they're topical. And as long as they're sold as a cosmetic, you can basically leverage a lot of this really great technology. I think in the long term here, we're going to see this same technology applied in a lot of different ways. Anything from joints to wound healing, burns. I talked to a dentist today actually who's excited about using this, for mucosal membranes and things in the dental field. Effectively, what we're trying to do here is say, what's going on when we're young? What's happening in our bodies when we're young and healthy and we're repairing ourselves very well? And what's changing over time so that reparative capacity is going away? And really, the best thing we can do, in my opinion, as of today, is to go back to these very young cells, to capture what they're producing, to purify that, to make that as safe as possible, and to put that in formats that we can use. And so we're starting with mesenchymal stem cells that are isolated from what's called the Wharton's jelly portion of the umbilical cord. So if you know people that are saving their umbilical cord, they're usually saving the cord blood. The blood is running through the cord, and there's a gelatinous part of that is called Wharton's jelly. That's where we're getting our cells from. That's done under consent. This is basically something that they would otherwise throw away. And a lot of people don't realize this, but the bulk of stem cell research is built on taking things that basically out of the garbage, it would have been thrown away, and making something very valuable from them. And so, like I said, the entrepreneurship story, the story of Elevai Labs, for me started a long time before co-founding Elevai Labs. I actually co-founded a handful of companies before this, had some issues where, my first kind of foray into this was partnering with a guy who was not a very good business partner and turned out to be a bit of a snake. And, ironically, my lawyer is here in the room with us. So if you're looking for a guy, it's a good lawyer.
Is this billable time?
But effectively, you've got to really protect yourself. There's a lot going on out there. So I think what we see is the success, but you don't see all of the hurdles and all the mistakes and all the problems. And so, I'm happy to have one-on-one discussions with any of you if you're interested. But effectively, behind the kind of shiny exterior, I've been through all of the problems and had to figure it out. The biggest one for most is funding. And, I would say with the company Elevai Labs, it's, a lot of it is luck, a lot of it is timing, a lot of it is having the right idea, a lot of it is who you're partnered with. Previous to this, I was working on self-funding, talking to investors, private investors. This time around, like I say, this is probably the fourth time I started a company. And in Silicon Valley, it's sort of default that you go to venture capitalists. Stanford is right on one edge of it is a road called Sand Hill Road. 25% roughly, they estimate, of venture capital is on Sand Hill Road. And it's almost comical. I used to go to the Starbucks on Sand Hill Road, and it looked a bit like a bunch of guys on a blind date. This guy coming in, and he's like, wait, you, me? Are we, they didn't know they're meeting, but they knew they're meeting somebody there, and they're having a coffee. And you could overhear conversations that are often probably leading to someone getting their Series A. And you never know who you're going to cross paths with. Some of the people there, there's so many successful entrepreneurs concentrated in that area, so many funders in that area. You'd be sitting next to somebody who is responsible for something you use every day and not know it. I went to one event and was sitting next to a lady who turned out to be the person who invented TiVo. And her husband was the person who made the first router. I was like, whoa, okay. So it's hard. A lot of people trying to copy that ecosystem. And I think, a lot of it is being in the right place, being around the right environment, and being around the right people. Here in Sacramento, we're not as lucky with that amount of funding. And I think for me, it got to a point where everybody knew somebody who had gotten funding for something. And oftentimes it was an idea, you're like, what, $5 million for that? And you finally get to a point where you're fed up. You're like, wait a minute, no, I deserve to get my idea funded. I've spent a lot of time, a lot of effort here, but you have to pay your dues. So I just say this as a preface that although the company was founded in 2020 and appears very young, there is a lot of work that has actually gone into what has developed into the company today. And so Elevai Labs, it's traded under the ticker ELAB, is actually two companies. There's Elevai Skincare, which I introduced that product, which is our first product. And we have a new line of hair care products that is coming out, which we recently announced in a conference in Las Vegas. And then we have another arm of the company called Elevai Bio. And Elevai Bio is really the FDA side, the clinical side. So if we licensed a couple of assets from a Korean pharmaceutical company that have been developed through phase 1. And this is tied to the kind of weight loss drugs of today. So if you're paying attention to things like Ozempic, Mounjaro, GLP-1 agonists, these are drugs that are used for weight loss, but they have a side effect that often up to 40% of the weight loss is muscle loss. And that might not sound too scary, but you really need the muscle, and the older you get, the more important it is. So the assets of Elevai Bio are aimed at preserving the muscle tissue. And so, now we have both kind of sides covered, and we have a lot of interesting things that we're trying to do on both sides to grow these ideas. But we took a very unusual path. So usually when a company goes public, it's an exit activity. You're trying to cash out. For us, we said, most of the time you see a company like ours, you're buying in, and most of the value is already taken off the table. The investors, the venture capitalists, the private investors, they already have inflated the value of this company to a large amount, and there's not as many multiples for the investor to really make a lot. And so we said, why don't we try to go the other way? Let's use going public as an early entry point for investors. Let's open this up to the retail investor, give them an opportunity to invest in next generation technology from the ground floor. And that's really where we started. So we did a fairly small IPO at the end of 2023. We acquired these assets earlier this year from the Korean company. We launched some new products this year. They're coming out very soon. And effectively, we're trying to grow this in multiple directions. And I'm hoping to keep that, a big chunk of that growth here in Northern California. And a lot of it has to do with infrastructure, a lot of it has to do with funding. So while my funding journey for Elevai was tied a lot to having a co-founder that had experience with the public markets and had some connections to investment bank, that really was a huge catalyst. I think if it wasn't for those relationships and that history of having brought biotech companies onto the NASDAQ before, I think we probably would have gone the more standard path for Northern California companies, which is local angel money and then venture capital money, probably from the San Francisco Bay Area. And so for most people, depending on your idea, I would probably say that makes the most sense for you, unless, of course, you have access to these. And I do try to connect entrepreneurs to my network and put things on their plate. But I would say, first and foremost, get that idea and get that funding sorted. What I see over and over again is people have a really great idea and they think the idea is enough that's going to kind of do everything else for them. You really got to work at the business side and the raising side and getting that funding secured as much as you're working on whatever your innovative idea is.
When did you get your first funding? How did you get your first funding?
The very beginning funding was, so my initial co-founder, who was the first investor in a couple other publicly traded biotechs, he had a connection to a couple of companies, including one that does work with stem cells. So he had access to some very unique stem cells that we were interested in. So he put his money in. I put money in. A couple other co-founders joined us, put money in. It was very much kind of friends and family round in the beginning. And there were a couple people in that early round that were part of a successful company before. That probably put in a bit more than you would normally be able to get from just your typical friends and family round. And a lot of it, we worked for free for a good amount of time, right?
Mm-hmm.
Made a lot of sacrifices, as you hear. And, I both of this company and the company I started before, the last three companies, there was a period of time in the beginning where I was working another job full-time and doing something on the side, having to start it that way. And, there's no shame in that. I think that's the way to do it. You have to pay your bills. You have to make sure things happen. And that was really what allowed us to get pretty far pretty fast. And so I would say, you need to make sure you think a lot about that runway. And if you're lucky enough to be able to do a lot of work without having to need funding or having to pay yourself, that's huge, right? I think that alone is what holds back a lot of people. That is what I'm hoping in this area with this sort of infrastructure, we can start allowing people who have the passion and the good ideas to access some funding to help. Because for so many, it's just literally like, how do I make sure to keep the lights on and, get my passion project off the ground? And I think what's often underestimated is the amount of money and time it's going to take to really get there and get it going. And so that's very critical.
So did you totally bypass you got your kind of friends and family stage, you just totally bypassed the Series A and just went public? Is that kind of what happened?
We did a Series A, and then we had the IPO in our sights. So I would say from day one, because we had people on the team who had taken companies public before, we knew that was going to be our path. We had a strong, and not to say that we didn't have others. I did have an angel investor at one point early on who said, I want to fund this whole thing. He basically wanted to buy us out early. And we said no. And the public, going public, a lot of it is you need a good bank. You need a good investment bank that has your back, that's really going to cover you, that understands startups, that's willing to go the extra mile. We were lucky to partner with an investment bank called Univest, and they were very hands-on from a pretty early stage. They saw a lot of potential, and they continue to be a good partner for us. And that's something that, the relationships really, really matter there. So we were lucky in that regard, but we did a kind of friends and family. We did another kind of raise internally for people we knew. Then we did a Series A. And then it was pretty much when we were doing the Series A, we knew that the IPO was next. And it was just a matter of like, how can this amount last us until then? And I'll say, the market, IPO market in general, has been tough for a long time. We saw this overvaluation of a lot of companies in 2021, and then a steep come down after that, and it's killed a lot of companies. It's destroyed a lot of value that was previously there. A lot of things have shifted. We were lucky again to have a good partner that was able to get it done for us. And it's same as ever. I think every entrepreneur says you got to be scrappy, you got to be cost conscious, you got to cut corners sometimes to make sure that you get over these finish lines. And that's really hard, especially when you're in a high tech field and there's not a lot of room to cut corners. You really have to follow the rules and do things the right way, right? So, but we've been lucky to have these really great funding partners from the outset. But yeah, I would say again, if you're just starting out right now, people ask me, would you recommend that we go public? And it's a real case by case. I don't know that I would recommend the IPO path for most companies, right? One of the key things for us is you need to have your accounting really solid, right? There's been enough problems over the years that now going public is really about having your books in order and following a certain set of rules, and the number of rules, the type of rules are only increasing as time goes on, usually because of some bad actors previous to that. And the IPO system network is not generally built for smaller companies, right? But at the same time, once you cross that threshold, some friend of friend gives us a deal, and we took all of those things and stacked them up to be able to save enough money to do this and get it going. But once we got that critical kind of mass going, it was sort of a snowball effect from there. We launched the product in January 2022, and we really went for it. I think the other thing I'll say is, if you are confident in what you're doing and you're willing to kind of really follow your passion, you have all those things you're scared of, all those things that are hard, all those things you don't want to do and you don't think you're ready for, you have to do it, right? And, going public is not something that I had done before. It's not easy, not something I would necessarily recommend for most people. But at the same time, we were looking at our options and we said, this is the best option for us. And that's really how you have to think as an entrepreneur all the time, is what is the best option for us today to get it done? And, we were lucky to be able to save money coming from the Bay Area over to Davis, and then again, moving more towards the Sacramento area. And, the initial sales and everything were great, but really what we did at the beginning that helped us a lot was we found a biomedical conference where they look at new aesthetic products. Basically all of the high-tech stuff that is out there, this is the conference that they go to kind of showcase it. We were lucky enough to win the People's Choice Award right out of the gate. People recognized right away that we had something interesting and different. We had literally like a dozen bottles of product there to show off. And I remember, I think half of them got stolen. We turned our back and then we're like, oh, I think I saw one of your competitors walking off with a bottle, and it was, so we laugh about it now, but we knew at that point that we were disruptive because people were doing these things because they were scared or they wanted to know more, they're really interested. And that community that we built through that network, which this happens in Newport Beach, where our headquarters is based actually in Newport. We went to that conference, met a lot of people. And then the year later, we went back to actually tell our success story of launching in our first year, which, we had decent sales, but, I think it was right around $1 million. It wasn't a ton, but we were proud of it. And we had our small team. And we went back and connected with the 2023 award winner of the People's Choice Award. And they had developed something also around longevity, anti-aging. And now the hair products that you see here that we're basically launching next are a combination of our two technologies. And so we're really excited about that. I got to announce that recently in Las Vegas at a big convention there. But, so much of entrepreneurship is this: getting in a room with other people that share your passion, trading ideas, keeping things flowing. Otherwise, it's very difficult, can be very lonely. Post-pandemic, a lot of people are still working at home in their office. They're very disconnected. And I can tell you all of the big breaks for the company have come from meeting people in person, shaking hands, conveying that passion person to person. And that really has moved the needle for us. And, after expanding from one skincare product to two skincare products to, having this team of mixture of 1099s and W-2s and selling online and all of this stuff, and then now adding Elevai Bio, just expanding, now I find myself refocusing back on Elevai skincare particularly because, going and meeting doctors, meeting basically our customers, because we're more of a B2B business, we're meeting the skincare professionals. That has been the best and most rewarding thing for us. That's where people really believe in us. The product, the brand is through this kind of interaction, this semi-education, right? This is not something I'm a bias for, etc.
I got a science question. How much, the stem cells have changed nomenclature. They used to be embryonic and pluripotent, and then they go through the lineages. But how much of this did you actually have to prove from an efficacy point of view, what your endpoint was from A to B, skin changes or, whether it's scarring or something? Did you actually have to do a lot of clinical studies or anything like that?
Yeah, so we continue to try to shift the paradigm and raise the bar on what is normal for the field of skincare. If you go to a typical consumer skincare location, brick and mortar, you will find a lot of products that have a lot of jazzy marketing. Some of them may have before and afters. You might be looking at them like, is it the lighting? Is it Photoshop? We decided, how do we go away from that towards more quantified, way of judging? And so I don't know if you're familiar, there's a system called the Vizia system by a company called Canfield. Dermatologists use it. You basically put your head inside of a device and takes pictures from 3 different angles, looks beneath your skin, and a computer system quantifies various aspects. I believe there's about 8 different variables that it looks at and gives you a really good judge of how you're doing. Can look at your sunspots, things underneath that you might not be seeing on the surface. And effectively, we chose to use that initially as a benchmark for us. So we took a before picture, you use our product for some length of time, take an after picture, and we started piling up 4, 8, 12-week photos and looking at the difference. And that's what became our initial marketing material. We've since gone on to work with doctors and do clinical studies. We have a few that the studies are done, but we still have to go through the publication and writing everything up. So we're excited about the possibility of doing that in the near future. A lot of people said at the beginning, why not just go after the wider market, right? You have something very special. A lot of people are going to like this, right? Our Infinity Serum is an MSRP of $300. It's not a price point that is approachable for everybody. So we said, if you're going to use this, you got to really believe in the tech. You got to understand what you're buying. And it's more of an education play. I'm not going to sell this in 10 seconds on Instagram very easily, right? And so we started with derms and plastics because arguably they are the most difficult customer, right? And so I'm literally going to medical conferences, aesthetic conferences around the world, speaking, educating, and then typically as part of the education, they learn about exosomes and stem cells, and they say, oh, is there a company behind it? Is there a product? And I go, oh, yes, there is. And that has actually spurred a lot of our growth. A lot of our key opinion leaders, came through that. So like one of the biggest ones was, it's called Beauty Through Science. They do a conference every year in Stockholm. And so I've now gone to that conference 5 times, met some of our doctors. One of our doctors is a #1 dermatologist in New York by Newsweek magazine. And she takes our product on TV and shares it with influencers. We recently had a doctor in Beverly Hills use our product on Kim Kardashian. And so, things like that, how do we leverage that? How do we use that? Because our marketing budget is very small, compared to the L'Oreals of the world. But my basic thesis here is go after a very slim niche, right? Because this niche is not going to cost as much marketing dollars to go after than everyone, right?
Yeah.
If you just pepper Facebook and Instagram with a bunch of ads, you're going to burn all your money real quick, and you may or may not actually get anything from it. We're now starting to look a little bit more at paid ads and e-commerce, but we really wanted to get our foothold in with these healthcare professionals because they not only sell the product, but they end up telling their friends, telling their patients, everyone. It's a lot of word of mouth and organic. And similarly, if your product doesn't work, that goes around very quickly too. And so, we were confident in what we're doing. We know our stuff. I have a lot of these relationships personally. So I'm like this uncomfortable kind of Ronald McDonald character for the company now. But at the same time, a lot of our customers really enjoy that. They want to meet the people behind it. They want to know that the person behind it has done the work. And to your point about stem cells, I started off leaving here around 2001. And if you remember, 2001, George Bush banned embryonic stem cell research in the United States. And the only university in the country that had viable embryonic stem cell lines you could still use because you couldn't make any new ones was Harvard. So I was lucky enough to go over to the UK where this is not an issue. And I knew that there was going to need to be a way to move away from embryonics. So my whole doctorate was really about creation of a system to not use embryonics. And I developed a system to take skin and convert it back to a pluripotent stem cell state, what we now call induced pluripotent stem cells. And it built off of the work of a guy named Shinya Yamanaka, who won the Nobel Prize in 2012. And then, in 2013, I believe it was 2013, there was a Nobel Prize around exosomes, right? And so we're just building on the shoulders of giants here. But that's where I started was, how do we take a fully adult cell and push it back, de-age it, right? And ultimately, we moved from pluripotent stem cells. I moved from pluripotent stem cells towards mesenchymal stem cells, and sometimes they're called multipotent signaling cells and other definitions. But largely, we still use the term MSC. And we did this because these multipotent cells are a bit different. They're not embryonic. We don't use anything embryonic. We don't use anything fetal. We have to be very ethical about the sourcing and careful about the testing. But these provide a lot of the benefits. And if you were to damage yourself today, you break a bone, you cut yourself, you burn yourself, your mesenchymal stem cells, which exist throughout your body in different percentages, are going to play a role in that recovery and repair process. And so really what our product boils down to is you can do it the old way, which is to cover up the problem. And you can also do it kind of like what I call hero ingredient method, where a lot of products today say, oh, we've isolated this thing from the plant, or we've made a chemical in the laboratory, or we've put together this peptide. And then they tell you this big, beautiful story around how great it is, but it's not going to cure everything. It's not going to do everything for you. It's more marketing than anything else, because our bodies are complex. There's not one thing. It's not just collagen. It's not just elastin. There's hundreds of things. Your skin is not just fibroblasts. There's multiple cell types. So we have to look for what is the kind of denominator, common denominator, and it's mesenchymal stem cells, because they are talking to all different kinds of cells in your body. They are sort of like the conductor of an orchestra, telling the different cell types what to do, how to act, and guiding that process of healing. And so that is the population that is often not acting like it did when you were young as you age. This is why when you're a child, you scrape your knee when you fall off your bike and it heals up scarlessly very quickly. But even in your 20s and 30s, you don't see that level of healing. And the older we get, the slower it is. You're left with scarring, often redness and discoloration. So the more we can put back what is lost, the more we actually support your cells, the better off this is going to work. And so that's the fundamental thesis for what's being called regenerative skincare, is this idea that just like we're taking vitamins at home to support and boost what your diet is giving you, if you can put things on topically that are really supportive instead of things that are covering up problems like makeup, you can make some good strides here and end up with skin that looks better because it's healthier, not because you covered it up with a bunch of pigment. Yes, sir.
What's your focus on wound care?
We do not do anything with wound care. We are technically a cosmetic product. So what we'll find is that we are taking science from the stem cell world, which is often associated with wound care, and we know it plays a role in that. And we're saying, okay, we know that these cells that are involved in wound care are producing a lot of good things, and arguably there's some interconnectedness there, but we're taking those things out and putting them into a product. So if you're familiar with growth factor products, topical products, things like hyaluronic acid, for example, is an extracellular matrix protein, commonly used topically, also used as an injectable and filler. It's also the main thing in amniotic fluid. Amniotic fluid is mostly hyaluronic acid. So we said exosomes are normally existing in a hyaluronic acid. We've seen a lot of hydrogel research there. We can make a shelf-stable topical if we do this the right way, and that's effectively what we've done. So there are people out there using these kind of technologies in academic labs and research labs for things like that, but as a cosmetic product, we don't market anything like that.
Well, the reason I ask is it seems to me that, particularly if you have a chronic wound in an older adult, if the key to the healing process is potentially the mesenchymal cells, isn't there an opportunity there for your company to create a product that would help with wound healing?
Arguably, right? I started off with adipose-derived stem cells because we can get them from liposuction aspirate, and I've looked at a variety of different ways to get stem cells and use them. I still consult with some people around this, but effectively, if you're doing something that is curing, treating, diagnosing, that's firmly the FDA path.
Right.
And so now that we have Elevai Bio, we have entertained that kind of an idea. We haven't done anything there, announced anything there, I should say, but it is something that is on our mind. We have the potential to do it, but it is a very different path than the one that we're on with these products because, it's kind of like church and state here.
Sure. I'm not arguing that. I was just trying to understand that. It seems to me that there are some FDA path products that if you have this working in this other more cosmetic space, there should be other opportunities.
There's a number of companies that are looking at this. We develop NCs here also in accidents. We've talked to about this a little bit. But those people headed down that path. But it is that's what we're saying, it's a long path, right? You have to do your clinical studies, your clinical efficacy, and safety, and all that stuff.
FDA is 10 to 15 years and, $150,000.
People
maybe
been at
50
for
million. Million, not thousand.
Yeah, no, that's really what it comes down to, is that the things that we know are likely to work in theory, you have to really draw the whole path out. This is a story I often tell, is that I know that there was Dolly the sheep was funded by a company called Geron, a California company. And Dolly was born in Scotland under Ian Wilmot. Ian Wilmot, I had the pleasure of meeting when I was doing some doctorate work in Sheffield, a couple of hours south. We were both working at the same time on this reprogramming problem. And we didn't know at the same time that Shinya Yamanaka was also working on it. He came up with a much more elegant solution that we've all kind of adhered to and moved more in that direction since. But effectively, that company, Geron, had also other things going. They were taking stem cells and converting them into nerve and nerve progenitor cells. And they were doing experiments with mice and rats where they would basically cause a spinal cord break, cause paralysis, and then healing it. And I think you can still find these videos. They more or less cured paralysis. And then they moved to do this in humans. And I don't know for certain exactly why it never came out. The rumor I have heard was that there's only about 20 people in the United States to get a mid-back break, most of the people getting a break at the neck from whiplash. And they were not able to treat these people because if you were a paraplegic and then they injected you with stem cells and it went bad, you could become a quadriplegic. So the risk was too high. And so they had to get a mid-back break, and they had to get you within 1 week of the injury. And so you can imagine, you're waiting the whole country for someone to have a terrible mid-back break, rush them stem cells, get them to sign the paperwork, inject them within a week before the scar tissue built. It was not practical, right? So that's what I heard is a rumor why it didn't go through. And who knows what the full story is, but effectively there are these scientists, a guy named Joe Gold, ended up moving to be my advisor underneath my PI, Joe Wu, like I said, is now running the American Heart Association and a couple other companies like Greenstone Biosciences. And, these people they've seen the cures for a lot of things that are not out yet. And, a lot of these sort of meetings, especially in the biotech crowd, there's a lot of frustration. I just was speaking at a conference called LA Best at UCLA and met some really interesting CEOs that had, one of them was offering something that was kind of exosome or secretome based that helps to kickstart or restart the immune system. And you could hear the passion and the frustration because I think we know that this is just on the other side, all of these really great things, but we have to do it safely. We have to do it the right way. We have to make sure, and this is hundreds of millions of dollars for most of these kind of things to get to the market. So I'm trying to remain patient myself, but this is sort of our answer to it, is like, how do we make revenue and do the cool stuff at the same time? How do you, and how do you fund this expensive stuff if people are in a depressed economic environment where it's hard to get anything done? Yes, sir.
One combination I'd like to add from the pharma side, medical side, you may have great products and exciting products and very innovative products. There's, as was articulated, there's many barriers to entry, not just cost, but time and access, et cetera. But there's also barriers within it, and around reimbursements, providers picking it up, payers picking it up, patient utilization, patient compliance, efficacy. It then starts down the whole in-market process that are barriers to entry as well. So doing a buy and bill side, which is the rheumatoid side, and having that access and lower barriers to entry and cost and time, but also you can get centers of excellence for doctors to pick it up for you and help actually drive it for you, whereas reimbursement is another issue, we say.
Yeah, well, and there's a couple of things I'll add to that. One is, so the Elevai Bio is very much the buy and build model. We've licensed it. We're putting the scientific advisory board together. I think we just did a press release in the last few days on a really great partner out of UCLA who's head of a metabolic health group there. So we're really excited about the team that we're putting together. And we know that drugs like Ozempic, the market is massive, right? It's way bigger than even these big heart drugs that have been historically the biggest drugs of all time. So we're confident that right now, what we have is being undervalued, and we're expecting the market will see that eventually. But, this kind of stuff, it is a path to revenue. And if you're looking around at doctors today, you'll notice more and more people are moving into aesthetics because it's a cash pay business. So even doctors, traditionally well-paid individuals, are moving into aesthetics because, they don't want to deal with the payers and they're having all this difficulty. We're seeing nurses come in and set up their own place. We're seeing dentists come in and do Botox. We're seeing doctors, they're coming from the ER. Now they've got weight loss clinics offering Ozempic. At the end of the day, they have to be both practitioners and business people, and it's getting harder and harder to do that. And this is where the aesthetic track has been so interesting for a lot of people. And I think where this is going, and where I believe this is going for us, is I don't think about us as purely an aesthetics medicine company. I think of us as a longevity company because, it's not just about looking younger. It's about feeling younger. It's about being healthier longer, right? So words like lifespan have been replaced with health span. And I think that's the general mindset, is how do we understand our bodies well enough to support ourselves better than we have before. It's not just about like multivitamins anymore or eating your vegetables. Like we're really getting it down to a science, and more people are understanding that on a higher level. I think the term biohacking and longevity has now taken on new meaning in the last 5 or 10 years, and we're just really getting started, I think, on what's possible there.
So I'll switch gears a little bit because I think you touched on it a bit about being a health company and IPO. Can you speak a little bit to the difficulty in setting up the financial reporting and the accounting side of things for being public?
Yeah. So this is the reality is that when you're a private company and then you go public, you're almost starting another company. There is the company that is on the stock market, that has reporting duties, that has NASDAQ obligations and SEC obligations. And what you're really signing up for is some special lawyers, some D&O insurance, some special accountants, layers of regulation to make sure that you're doing things above board. And so you absolutely have to be above board these days in order to even consider it. And that's something that, we never had a problem with. But at the same time, very expensive. So the main reason most people, I wouldn't recommend that you go public right away, is because there's a lot of investment there. And so unless you're going to raise a good amount of money on the other side to compensate for that, it's tough. And while there is this revenue generating side of an aesthetics product early, which is very tempting for a lot of people in science, the other thing, it's very true, and they actually joked about this on the TV show Silicon Valley, was the minute you become revenue generating, they want to judge you based on that revenue. And that's not always fair when you're a very young company, right? And I forget the episode now, but they were joking about one of the venture capital investors tells the guys, they said, we have a way to make money right now, and it'll be really valuable. And they go, no, it's much more valuable to be in stealth mode, pre-revenue, right? And it's sad, but I've experienced this firsthand, that it can be more exciting for investors to be pre-revenue than it is to get out there and get in front of your customers and sell something and do the work. Even though I think most people logically would say, no, that's way better to get to know your customer right away, to make some amount of money right away, than to sit back and hold back and just, toot your own horn and make a lot of noise and not get any revenue. But the reality is the minute you turn on that revenue, they start judging you on that revenue, and your value is tied to that. And so you have to be careful about how you project yourself and how you value yourself, because, we believe that we're firmly undervalued compared to, the technology, the customer base, what we're offering. And the frustrating thing is you look at things like AI, all the AI companies are way overvalued, arguably. They're being, the potential, their price today represents their potential, not really where they are yet. And we're waiting for that to happen in the world of bio. And very few companies have the privilege of being valued at their potential before they reach it.
You kind of touched earlier on how you were talking about injections, but there was kind of like an FDA hurdle, and so you have to topical. Can you talk more about how do you find the decision to kind of bypass that thing, or to, you know, the technicalities around that. And yeah, who helps you make the decision? How do you manage that pivot?
So for us, we knew from the outset this is what we wanted to do. I knew of other companies in our space that were offering exosomes, and they were getting groups of people together, doctors, and they were kind of like, this is topical, wink, wink. And the FDA figured that out pretty quickly. And, you know, you can look at their website and you can see that there are exosome companies and even doctors that were doing this, and they were slapped on the wrist multiple times. And so, you know, we saw, like, really to go back in history here, in 1995, there was a company called Isologen. It was taking skin punch biopsies from behind your ear. They grew that skin out in the laboratory, not unlike what is here in Cleanroom. And then they would make that into single cells, inject that back into your face. So you are giving yourself back your own skin cells after they've been expanded. And this worked wonderfully as an aesthetic product. But the FDA said, look, you take this out, you take it to a laboratory, that's what is known as more than minimal manipulation. And so if you do more than minimal manipulation, you leave the clinic and you do something in another laboratory outside, that presents risk, and they don't like that. And so that company ultimately didn't really make it as an aesthetic company. And fast forward about 6 years in 2001, Allergan, well, this company called Skin Medica launched a product called TNS Serum. They effectively took circumcision leftovers, grew those out in the laboratory, and they took that liquid on top called media. They took the conditioned media from the cells. They put that into a product as an ingredient. And that is still today, over 20 years later, a highly, you know, profitable product for them. So Skin Medica was bought by Allergan, Allergan bought by AbbVie. This is still, I think, a $270 product today, 20-plus-year-old technology, because the FDA has more or less said, yeah, that's a topical, you're not putting cells in or on anybody, as long as you're being careful and you're going through a cosmetic GMP process, they're allowed to do that. And so they sort of set the stage for this, and now 20-plus years later, we're just taking this up a couple notches. We're doing this with better cells, and I think the previous paradigm was to take everything that a cell releases, which includes the exosomes, which is good, and a lot of other stuff, which is maybe not as good. Yes, sir.
So a lot of challenges that startups have is finding the right product market fit. So after you launched the product, did you realize that your product market was pretty accurate, or did you have to pivot in a different direction?
I have the benefit of this not being my first go-around in aesthetics. So I started a company in 2015 as a scientific co-founder, and my co-founder at the time had been in sales in aesthetics, and so he knew enough about where to sell, how to sell. I knew enough about the science. We put the two together. We made a product that was built from adipose-derived stem cells. That guy turned out to not be a good partner. We were shady, had a lot of problems. I went through a legal battle to extricate myself from that. But that was a 5-year journey where I basically made a lot of the mistakes. And at the end of it, you know, I saw where the field was going. I saw what the future looked like. And because I, you know, had my finger on the pulse, I was able to take my knowledge and start over and make something better and different. But I learned a lot of lessons from that. I think there are no shortcuts in entrepreneurship. If you're lucky enough to have a close friend or family member that can give you an inside track, then you're lucky. But as most people tell you that do an MBA or spend time like this, nothing like running your own business. You just got to get out there and do it, right? Like so many things in life, you can watch sports, or you can play sports, and you know the difference if you've done both, right? It's very much like that.
I was going to ask about sport injuries. It seems like stem cell treatment or procedure are becoming very popular, common among athletes, especially like in the fighting kind of world. I see them going like overseas to do procedures, and it's not thinking of all the information. I don't know if you guys are thinking of that.
We are very firmly following all of the FDA rules and staying very much in our box of being a cosmetic. We do not do anything injectable, but we're aware of all this. And I still have a lot of friends or friends of friends that come to me and say, we're where should I go to get this, stem cell treatment or whatnot? And a lot of times I'm not able to give them a recommendation because I would never recommend something I didn't know the people personally. But certainly there are good clinics that exist. And unfortunately, I think there's a ton that are probably not reputable. And so you can imagine with someone that has a PhD and a postdoc in stem cell research and regenerative medicine, I don't know how people who don't have a science background can make an informed decision on this. And I think this is why these clinics like to get the athletes to brag, because that's a real credibility marker. If someone with a real injury that that's big is, and that's probably helped a lot of the growth there. But,
I can give you a good example, Jordan, with the stem cell. I was selling the albumin, which is needed to freeze the cells, and they were using it for injection into joints. So they're going to orthopedic doctors saying it's great, stem cell, it'll heal everything and do it. And we didn't realize at first what they were doing. And then when we realized, wait, you're injecting a research grade, a non-therapeutic into the bodies? They go, yeah. They didn't have an issue or concern with it. Then we delved deeper and found that their PhD was physiology, basically glorified PE, nothing, you are, sorry, I didn't mean to insult you. So that was very common. That was only 4 or 5 years ago. We said, oh, we're not touching you. Goodbye. Go get your stuff from somewhere else. And that's when I met Jordan, I was really impressed with his background because there was a scientific there. And I like how he's separating the two. It's not that you don't want to do FDA stuff down the road. You don't want to go down that road. And there's too many shitty characters that can cause you problems beyond belief.
Yeah. Well, and we know some people that are in the kind of advanced biohacking world that you might know their name, you might have seen them on TV, and they're willing to go, to try to squeeze a few extra years out, try to make personal improvements. And people, I believe you should be able to do what you want with your body within reason. But unfortunately today, you probably do have to go outside the US because we are a safety first focus here. And even more so arguably in other places like the EU. But as we've gone around the world and tried to take our product in different things, different places, we find that different people have a different opinion on what is and isn't safe, what isn't natural. Generally speaking, animal products, in my opinion, you want to be very careful. Anything sourced from an animal. And we have an animal-free process, which in the cosmetic space in America is very important. No one wants to harm animals. No one wants to have anything in or on their body, generally speaking, from animals. But a lot of other companies that are using cells as the factory for what they're producing, they are not following this because it's, significantly cheaper to use this. And I'm surprised to find places that are against a lot of human-derived products will accept animal-derived products. So a lot of places in Asia, they have a product that's made from like red deer umbilical cord or something, and it's very popular. And for whatever reason, they don't seem to care. But it's hard for us to take a human protein or human-derived. And so some of it is regional, some of it's regulatory, a lot of it's a combination of both. I hope that as these places overseas get more, they have some proven safety record, we might eventually bring it back here. But you can imagine if we just sort of open the floodgates, all hell would break loose and everyone would be doing whatever their favorite MMA star said to do. And I don't think you want your healthcare dictated by your MMA star.
Yeah. I guess the bottom line, none of those procedures in the states are FDA approved. But shoot MSC's got to know. That's why they're in Central America.
Yeah. Yeah, and the truth is there are some good ones out there, so I don't want to pretend that there's not. I think you really got to take it case by case, but the unfortunate truth is it's very difficult, even with someone with a science background, to delineate on the surface, is this legit, is this good? Some of these ones I think are maybe hopefully just giving you something innocuous, but worst case scenario, you're getting something bad. And we've seen this even in aesthetics recently, where there was an unlicensed individual who was supposed to be changing the needle tips out on their treatment. They didn't, and they would manage to spread HIV. Things like that do happen. And so, this is why you have to be very, very above board on everything. And you can't always control on the end users, but, we do our best to only sell our product to, people that have a validated medical background. So it's not just the science. You have an individual who knows a bit more than the average that's telling you about the product, because we believe this is a high education product, and the people who are going to pay the price point we're asking, they really care about that.
And so a lot of you were spent in the lab. Can you talk about your learning the pitch, learning the finance, and learning to speak to VCs, learning how to give a talk and polish? Can you speak to that part of your
I'm going to take that as a compliment because it sounds like you think that I have polish. But it takes compliment. I don't believe I have much. Honestly, I'm very much an introverted, more of a science nerd kind of a person that has forced myself out of my typical bubble to meet people, and only through having multiple successes by doing so have I continued forward and made more and more connections. And I think ultimately what's served me most is that I think people sense a level of authenticity. They know that they're not being sold. They know that I'm not making up my background, which unfortunately happens in this field. People will pretend that they have experience that they do not. But, you know, it's practice. Like anything else, it's practice. And, you know, I think today we're in a world where so many people will speak about things that they don't know as if they do. And the people who really do know are often the ones that are least likely to speak up. And so, you know, I've had to learn to, you know, have a bit more confidence in what I know and to be more aggressive and extroverted about it. And it has, you know, it's been a journey. If you would have talked to me 10 years ago about this, you know, I would have turned down an opportunity like this, probably because, you know, part out of anxiety and part out of, you know, convincing myself, oh, it's just whatever, it's not going to move the needle. But oftentimes these are the things that move the needle. And we got to really build this community here because it's the person that you least expect often that connects you to the person that opens the next door.
We're ready for your next talk. All right, one more question if you want to ask. We'll do each question.
Okay. Quick thing about penetrating the market's not easy, particularly with fertilizers. When you had this product, was your approach generally actually really knocking the doors, or was it a lot more conference-based where you educate them and they would permeate that knowledge to them?
Personally, I prefer having a bit of a hype man, right? I can get up and tell you, oh, I went to, you know, top 10 university in the UK, top of my class, went to Stanford, brag about myself. It just starts to sound really, you know, arrogant. Whereas if I have someone on my team that can introduce me at a conference, speak, that tends to be much more effective. That's the reality. I am not a natural salesperson that wants to go knocking on doors. I've generally hired people in with that type of expertise, and it's more of a collaboration. And my understanding is it's kind of like software sales today. You've got the sales and you've got the technical sales, right? I've been the technical sales guy on this side of it, right? I need you to have a little bit of an interest, but then I will overload you with the facts and I will tell you more than you ever wanted to know. And you'll see very quickly that we're a very technical and very serious company about what we do, but you got to want to hear it first, right?
Well, there's two more questions.
University lab, not particularly. So when you did that, I assume you had to do some sort of animal testing. When you can go to like a third-party lab, something like this, are there people there that help you manage that?
I went to an incubator. First, I went to an incubator space at Stanford. So Stanford had something called StartX, and then a member of my lab actually started StartX Bio. And it was very small, very open. I decided it wasn't for me. I looked at a bunch around the Bay Area, and after looking probably at 10 or 12 options in the San Francisco Bay Area, I ended up going all the way to the south end of San Jose, where they had these closed door labs, a little bit cheaper than being in like San Francisco. And with our product, because we're starting with human cells producing human proteins and did a lot of testing up front, all the safety things up front, we looked at what was out there in the market, such as this TNF serum, and we said, okay, like animal testing is not actually needed. We're not doing a disease model here. This is like a narrow, but, you know, a path that exists, and that's where we went down. And, you know, I come from this background in biochemical engineering where biochemical engineers make cGMP labs. Like that was my undergraduate thesis, was how to build a GMP lab for the manufacture of a pharmaceutical, right? So I understood all the kind of workings better than most. But arguably, you know, if you're going to go into cosmetic field, you want to stay away from animals. Whereas like on the other side, the drug side, you always can't avoid it. So we've seen both. There's always outsourcing options. If anyone here is in this stage where you want to be connected to someone doing some animal work for drug testing, I can connect you to some people. You know, it's a relatively small world, an interconnected world. But we've been very careful to, again, church and state with this because we don't want any animal-derived anything touching our cosmetic products.
All right, last question. Just continuing on the question of the transition between like academic science backgrounds into business, like what were some of the more unexpected things that you encountered that surprised you?
I think my experience has been, especially with science-based entrepreneurs, is that you get people who think, I got this great idea, and the great idea is so great, it's going to sell itself. It's going to do everything. I just need to go and talk and get a patent, and then someone's going to buy the patent, someone's going to give me money. I think, you know, being an entrepreneur is about thinking about the worst case and planning for the worst case and hoping for the best case and acting like it's the best case all the time and walking both of these paths simultaneously because I can tell you most of the people I know that had a legitimately good science idea, some of the smartest people I know had some of the hardest times. They were not able to get the funding component or they weren't able to partner with the business person. So they might have something, but they can't get it out there and they don't have the personality or the wherewithal to figure that out. And I can tell you, it took me not through my undergrad, you know, but much longer. At the end of my undergrad, I actually won a business plan competition in the UK and they had lab space and money, but it wasn't enough to get going and really build anything. So I took like a couple $1,000 prize and I said, keep your lab space, thanks. And I'm not going to be able to pursue it with the little you've given me. And I don't, you know, I'm going back to California. Came back and eventually, you know, I did my doctorate. I joined some entrepreneurship groups, started to set up some consulting companies with friends, made all the mistakes along the way. And, you know, it wasn't until literally after doing a postdoc and doing 5 years of kind of making all the mistakes with the previous company that I think we've ended up at a place now where, you know, Elevai Labs is built on all of that experience. So, you know, don't underestimate how hard it is. I think every entrepreneur gets up and says it's hard, it's really hard, you have to really want it. That cannot be overstated. You have to, you know, this is not the best way to make the most money. As an entrepreneur, you have to really be passionate. But if you're willing to be persistent and you have a real passion for it, you know, this is where you're going to meet the people that will connect you and speed things up and allow you to get over that much quicker. And if I could go back, like I would be going to one of these kind of things or meeting up with other entrepreneurs and funders and people who want to help the ecosystem every single week because it really does make the difference in the long term.
Please give Jordan a minute.